Coming to the key part of the event, the new roadmap for neglected tropical diseases. And here to introduce this session is Dr. Mwelechele Malechela, the Director of NTDs at WHO. Dr. Mwele, one of the targets of the roadmap is that 100 countries will have eliminated at least one disease by 2030. How confident are you in achieving this within a decade?
Thank you for your question. I'm confident because I have a lot of confidence in the global NTD community, our partnerships and their enduring strengths, as you've heard today. My faith is also built on the comprehensive approach of the roadmap, which is underpinned by three fundamental shifts, which I believe will accelerate progress. So first, the move from measuring process to measuring impact. And this means there is a focus on accountability. Monitoring our progress towards the achievements of the roadmap targets will be a continuous process over the next 10 years, building on and strengthening existing data processes at all levels. And this will allow us to innovate and adapt and modify our programs to ensure success. So we will not be going blindly. And secondly, our focus in the next decade must be on combining our efforts and involving people and partners in meaningful ways and ways of working smarter. And this means integration with the health sector, within the health sector, cross-sectoral collaboration, which has been talked about a lot today, but at the same time, keeping patients at the center of it all. Third, and most arguably the most important shift, is to facilitate and uphold country ownership. The shift from partner-driven programming to country-driven programs will mean that interventions will reflect the needs on the ground and that they also align with the broader global development agenda with a focus on primary healthcare and universal health coverage. The new roadmap, Patricia, represents a new way of working. It represents a united vision, and which has been co-created by all of us over the last 2 years. So it belongs to us all. It belongs to everyone, those who have been involved now and who will be involved in the future, from heads of state to partners on the ground, funders, community health workers, youth groups, and of course, those people affected by NTDs. I've been fortunate to enjoy a long career in NTDs, and the courage and commitment of some truly inspirational people has never failed to impress itself on me. And that's why I feel such confidence, because I know this partnership will deliver the roadmap, because as always, we are stronger together.
Yes. That is so true. Thank you, Dr. Mwele. I'm also so delighted that we will now be joined live by Dr. Matshidiso Moeti, the WHO Regional Director for Africa. Good to see you again, Dr. Moeti. Now, having heard what Dr. Mwele has just said, countries in your region have considerable experience in developing homegrown innovation in tackling outbreaks and epidemics. We've seen this happen during the Ebola virus disease and currently, of course, with COVID-19. How can such lessons help to really strengthen health systems to support the new roadmap?
Thank you. Thank you so much, first of all, for the invitation. I'm excited to be here and delighted to reconnect with the NTD community after this immersion in COVID-19 for over a year. And I'm delighted that we are finally launching the new roadmap. So with many examples of work that, of the lessons that are work on outbreaks, including on polio, which has been declared as a public health of international concern, have to offer for our work to strengthen our health systems and to help them deliver for NTDs. For example, we know that we will in the end have to reach some of the most difficult to reach people and areas and deliver services to them. And polio here has some interesting lessons to offer. For example, in the insecure and inaccessible areas in the Lake Chad Basin countries, satellite imaging was used to quickly map settlements targeted for vaccination, and also were able to use that to estimate the target population up to 95% accuracy even
Wow.
without physically visiting the areas to actually do a head count. And this enabled then the targeting, the quantification of what needed to be delivered to be much more accurate and to be done under these very challenging circumstances. In Nigeria, for example, again, another example from the polio work, geographic information systems were used to monitor service delivery and to ensure that vaccinators actually reached the targeted, underserved and hard to reach communities and areas, and also those who supervise them actually get off the main road and go and reach those faraway villages. So this improved accountability and now being able to see where we need to take corrective action to make sure that we covered service delivery gaps. In doing polio campaigns, again, we took the opportunity to integrate and deliver other services such as deworming, treatment for diarrhea, micronutrients, etc. And we can take this lesson to integrate into how our health services work more generally and find all the opportunities to deliver NTD services. Thanks to our polio program, all of our member states are now using GIS system to collect data in real time on vaccine stocks, on surveillance, on the performance of routine immunization. So not only are there lessons, but there are also systems being put in place in countries that are available for the implementation of the roadmap. We've seen now in the examples of our Ebola experience in countries like Liberia, the development of tools like M-Hero is an electronic tool that was used to deliver health messages to communities. It's now an integral part of the ministry's health information system to communities' work. And so what we've seen is that as we near the elimination of NTDs, finding the remaining pockets of people not yet reached will be extremely important. So technologies like satellite imaging, GIS will be useful. Innovations like appropriate low-cost technologies and integrated ways of working will also support implementation of this new roadmap.
So all super exciting. Dr. Mweti, with all these innovations that are going on and how they'll, benefit the implementation of the actual roadmap. So thank you very much, Dr. Mweti, for that. Now, between 2003 and 2005, Germany was instrumental in bringing together the scientific community by providing a platform for discussion and reconciliation of different views and opinions to lead the global NTD program. Now, earlier, I spoke to Dr. Maria Flaxbart, the Parliamentary State Secretary to the Federal Minister for Economic Cooperation and Development in Germany, and asked her if she saw an opportunity for her government in further promoting One Health and strengthening global action to tackle the rapid expansion of vector-borne diseases. Listen to what Maria had to say.
What we have achieved on the basis of the first roadmap from 2012 lets us to look with optimism to the future. With a view to sustaining and expanding the progress achieved over the last decade, we now need to work through an aligned cross-sectoral approach, shifting our focus from the disease-specific programs of the past to an integrated approach combining various measures to combat NTDs and mainstreaming them in national health systems is taking us in the right direction. When it comes to vector-borne diseases in particular, the One Health approach will enable us to better dovetail measures from human medicine, animal medicine, and environmental science. The BMZ has recognized the close link between healthy animals, healthy people, and a healthy environment. We cannot achieve one without the other. That is why we have set up a new directorate for global health, pandemic prevention, and One Health, thus giving the One Health approach within the BMZ an institutional and technical structure. We expressively support the increased tripartite cooperation between OIE, FAO, and WHO and the United Nations Environment Programme. Challenges are becoming more complex in our globalized world. A growing world population, climate change, increased mobility, degradation of formerly untouched habitats, and non-sustainable agriculture practices are increasing the risk of exposure newly emerged pathogens. Vector-borne diseases too will spread further. So our answer must be part of a One Health approach. I strongly believe that the new NTD roadmap is giving us a good tool. We are ready to tackle the new challenges, and we are looking forward to continued good and successful cooperation with all partners.
Dr. Carissa Etienne, a question for you. Quite the varied landscape that you cover in both your professional roles. And what is your vision for NTDs in the next decade in your region?
So thank you for this question. And let me begin by saying that we at the Pan American Health Organization enthusiastically welcome the launch of this roadmap for NTDs. And I want to congratulate all of the partners and international community. This launch marks what is a major catalyst to boost our joint efforts. Our own vision for the next 10 years is that many more of our countries will build on the elimination agenda that we have. Since 2013, 4 countries have eliminated onchocerciasis. So there's only one focus remaining in the region, and that's among the Yanomami population. We have seen eradication in many countries of lymphatic filariasis, trachoma, human rabies transmitted by dogs, etc. So I am looking for further elimination based on a plan of action that we have to eliminate several conditions and NTDs by 2030. So I have great hopes for the Americas based on the fact that the governments of the Americas have committed to this. We have strong experience in elimination of NTDs. We have built the multi-sectoral networks. We have strong partnership and strong primary health care approaches that emphasize care for the population that is marginalized and providing that surveillance that is necessary, because you'll need to continue. We have the targets, but we need to build up the local level, both at the national, but also in the local level, to ensure that they meet these targets. And that needs tenacity, and that requires commitment at all levels. Over.
Thank you so much there. To Dr. Mandari now, recently, many countries in the EMR have made substantial progress against NTDs. Tell us how this was achieved in spite of the challenges that many of them are facing.
Thank you very much, Madam Moderator, for this important question. And in fact, if I just may start by sharing with you, as you all know, EMR region is composed of 22 countries. 2/3 of these countries are undergoing either acute or protracted emergencies, with whatever sort of consequences of these emergencies on healthcare systems and other systems in the country. However, in spite of that, as you said, a lot of successes have been made. And just to share with you example of countries which we consider are stable, but at the same time countries which are considered with emergency and or fragile healthcare systems. Like, for example, when we talk about trachoma, Oman, Morocco, and Iran eliminated trachoma, and they have been certified 2 years back. Egypt and Yemen as well, they managed to eliminate lymphatic filariasis. Then soon, when it comes into trachoma, Tunisia, Saudi Arabia, and Iraq will be validated for elimination of trachoma as well. And at the same time, I'm proud to say that Saudi Arabia, Egypt, Morocco, Iraq, Iran, and Oman are on the edge, if I may call it, of eliminating schistosomiasis soon. In addition to these achievements that I have just shared with you, We are proud to say that more than 18 million people here in EMRO receive treatment against different types of NTDs annually. These achievements, as you said, in spite of the challenges EMRO countries are facing, due to many reasons, I just may mention some of these. One of them, and top in the list, is the strong political commitment that we have seen from top leaders, as politically speaking, as well as top leaders in the healthcare system at different levels. The second reason, if I may just call it, is the dedication of healthcare workers. We have seen a full commitment of those healthcare workers going into, sometimes bare feet, fighting these diseases in different geographical areas, and some of them are inaccessible. At the same time, and I must say it here, and I'd like us to send a word of thanks and appreciation on behalf of EMRO, WHO, and member states and communities, the generous support we received from all partners and donors. And I'm just pledging all donors and partners to continue that much support, invaluable support, which is saving lives, eliminating suffering of the people. We are hopeful that at this global commitment to achieve the sustainable development goals for neglected tropical diseases and universal health coverage targets will consolidate our gains in the countries to end NTDs, as you have mentioned, in earlier discussions, by 2030. So thank you very much for this question.
EMR has the highest global burden of cutaneous leishmaniasis. What additional support? Let's talk a little bit more about that. What additional support is needed to achieve the target?
I'm in a conference now, and I'm a speaker.
Thank you. Although I can hear some background, but this is also another important question. And I may say that, as you said, our region carries in numbers nearly 75% of the global cutaneous leishmaniasis burden. The disease, unfortunately, is endemic in 18 out of the 22 countries we have. And annually, member states in the region report more than 150,000 cases. And we noticed that it has been increasing for the last few years. There are critical technical and financial gaps, that will, or still, continuing hindering us from case management, vector and animal reservoir host control. To improve the case management, just answering your question, we need affordable and more sensitive point of care rapid diagnostic tests. It is very highly needed, especially as you know, many of our countries are undergoing, these sort of emergencies with fragile healthcare systems. We also need easy to administer, safe and effective treatment, which can be used in health centers and even at a community level, in which, especially in communities which access to hospital is a bit difficult. Better therapies such as cryotherapy, for example, or thermotherapy, I feel are underused in highly endemic areas because of their high cost. So this is something that we may start working on. And here I'd like to call also donors and partner support. Countries should be supported to scale up these effective treatments. If we want to say, yes, we are making major achievements on that area. Today, we do not have tools that work effectively to control the vector and animal reservoir. And this is another field area where applied research needs to be strengthened and needs to be done to identify the solution in a very innovative and creative way that will definitely help communities, especially communities with limited resources, communities undergoing emergencies, communities with fragile healthcare systems, communities having difficulties in accessing the healthcare system. So these sort of things that I thought to share with you, answering your question. Thank you very much. Back to you.
I'm going to move to you now. Thank you, Dr. Al-Mandari. I'll move to you now, Dr. Kanangire. How will the new roadmap support efforts to ensure collaboration between WASH and NTD stakeholders to help end NTDs?
Thank you very much, Patricia. First of all, I wish to congratulate WHO for this very important document. On this question, the first thing I want to remind ourselves is that with more than 7 of the WHO listed NTDs linked directly to poor water and sanitation services or poor development of water resources, I think the water community is really put to task to collaborate with other partners to address all these issues. And the water fraternity say that water is life and sanitation is dignity, finds its full sense in the prevention, elimination, control, and eradication of NTDs. The water sector will need absolutely to contribute to this roadmap by ensuring, first of all, universal access to clean water, access to safe sanitation, starting with ending open defecation, and ultimately providing access to safely managed sanitation and access to hand washing facilities with clean water. And AMCA, as the leader in this water and sanitation sector, we have been intensifying advocacy and creating synergies towards provision of water and sanitation services, promoting behavior change, building capacity at all levels, and addressing inequalities and inequities. And also we have been urging our member states and our development partners to focus on these key strategic actions so that we can create impact as far as water and sanitation services are concerned. And more recently, we decided to tackle wash bottlenecks from the root by developing the African Sanitation Policy Guidelines that will help African countries to develop policies which are aligned with SDGs and other high commitment that have been taken by our head of states and other high-level leaders. And we think that a WHO NTD roadmap is a great opportunity for us to strengthen the already existing collaboration and especially create synergies between WASH and NTD around the pillar, which is to intensify cross-cutting approaches. So on this, we want to strengthen collaboration and synergies. One, on policy improvement to address issues of water related to NTDs and prevention and control. Second, we want to undertake joint actions, especially with relation to monitoring and reporting joint sector progress that we will be making on this and build capacity to address behavior change. Third, we want to establish a WASH and NTD collaborative platform that will steer our joint collaboration and ensure that we are really contributing to the roadmap. And lastly, the WASH sector will want to add the End NTD to End Open Defecation campaign so that we can create knowledge in our constituencies and motivate them to work together for the same cause. We believe that if we do this and work together in the new approach and also make sure that we secure adequate political will and dedicated resources from each national country, we will be able to focus all those actions and indeed contribute to addressing issues and reaching the roadmap targets. I thank you.
Thank you very much, Dr. Kanangire. Aspects of this roadmap is to work with everyone. It also means engaging with young people across the 5 continents. And as you know, approximately 42% of the global population are under the age of 25, making it the largest youth group generation in history. Gerald Chirinda, I'll bring you in here. What are the ways in which youth can play a role in driving change for communities affected by NTDs?
Thank you so much, Patricia. And, before I answer the question, I'm particularly excited about, this specific roadmap launch, because I'd like to believe it is the first time that young people are part of not just the launch, but have been a part of the process that has led to this. So it's definitely a step in the right direction. Now, to answer your question, there are three particular areas, which I believe young people can drive change and bring about change in their communities. The first one is the area of accountability organizing. So that essentially is holding office bearers accountable for commitments that they would have made, whether it's at a particular platform to end NTDs. I think that the issue of accountability is an important one, and one where young people have been seen to be quite effective in terms of doing that. As a movement, we are also engaged at a policy level with regional and international bodies in collaboration with other youth networks within these particular regions. So we are playing a key role there to make sure that, before heads of state or ministers commit, we have it down on paper, we have it down as policies and communiques that we push forward. We are also engaged in engaging young elected officials, and with the aim of creating engagement platforms for them with young people, as well as with the content and the material of neglected tropical diseases, as most of them are not, generally aware of NTDs. The second issue is the area of education and awareness. So young people can play a key role here in bringing about awareness of basic treatment, prevention measures, and available health programs in as far as NTDs are concerned within their communities. I was quite inspired when we essentially youth combating NTDs in February last year in Tanzania. There's a group of young people that came to us and they said that they were actually setting up an NTD club at their school. So I think these are, incredible ways in which young people can engage. We also recently carried out a storytelling competition. And, initially we were thinking, okay, not a lot of young people know about NTDs, but we were amazed at the number of young people who actually engaged in the storytelling competition itself. Across the 4 categories, I think we had close to 1,000 applications, which just goes to show, the potential that exists in actually telling the NTD story and telling it in creative ways. The last point is on innovation, Patricia. Young people are innovators as well. They have the ability to innovate, so we need to be able to harness that ingenuity that, young people carry across the different value chains of neglected tropical diseases, whether it's working with, health structures and carrying out practical troubleshooting of existing issues that are within the programs in various countries. They can play a part there. We have within our networks, as an example, young ladies who are developing a platform to, communicate health-related issues to their communities using mobile phones in their local languages. We also have, across various sectors, young WASH innovators, young people who are engaged in last mile delivery, as well as diagnostics. But lastly, what is important for this success and for these young people to be effective and successful in what they do is partnerships. And as Youth Combating NTDs, we are humbled by the support of the Uniting to Combat NTDs partnership, the relationship that we have with WHO, and the enthusiasm and energy that we have seen coming from young people across various youth networks who are willing and are keen to collaborate with us. So, that essentially those are the areas that I see young people playing a role in driving change within their communities. Thank you.
Always giving great direction and vision there, Gerald. Thank you so much. We'll be heading over to UNICEF now. One of their key mandates is education. And we spoke to Dr. Andreas Hassmann, who's a nutrition specialist, and asked him the following question: how can the fight against NTDs improve educational outcomes?
UNICEF Nutrition and UNICEF Supply Division work closely with WHO to address the burden of soil-transmitted helminthiasis in a collaboration that showcases several of the key features of the new NTD roadmap. STH has serious negative impact on children's nutritional status. It impairs cognitive development, and it causes the loss of millions of Dalis every year. And as you know, WHO recommends preventive chemotherapy as a temporary measure to control morbidity. Preschool-age children are reached with preventive chemotherapy, typically delivered with vitamin A supplementation in integrated cross-sectoral campaigns known as Child Health Days. UNICEF and WHO work closely together to ensure minimal fragmentation and optimal coordination across programs and to increase coverage. Currently about 55% in the 92 countries where preventive chemotherapy is needed.
What are the main challenges going ahead, Dr. Hasman?
This level of coverage is obviously not satisfactory, and there's still significant work for us to do in the years ahead. An important reason for stagnant coverage in recent years of both vitamin A supplementation and preventive chemotherapy is the loss of delivery platforms. Polio campaigns have become less frequent in some countries, and other countries have struggled to fund integrated campaigns. It has therefore been necessary for many countries to move delivery from campaigns to routine contacts, and high coverage has not always followed. COVID-19 has presented additional challenges to coverage. It is beyond question that an integrated approach, implementation research, cross-sectoral collaborations, and other initiatives that the roadmap sets out are the way forward. At UNICEF, we look forward to continued collaboration with WHO in the area of neglected tropical diseases.